Bänder, Sehnen und
Knee injuries to ligaments, tendons, and meniscus are often caused by falls, although the meniscus can also suffer damage from a twisting movement under load.
häufig auch im
And during the descent, when you're already tired and less coordinated in your movements, you can easily stumble or slip, which can also result in a knee injury.
Folge für solche Knieverletzungen.
No matter how the knee injury is caused, through a fall, a twist, or tiredness, it will always involve swelling, strain, movement or pressure pain, a feeling of instability or insecurity in the knee joint, and there may also be bruising. At this point, the tour is over for the accident victim. The trusty Rice method will come in very handy here, since it reduces pain and internal bleeding. The word Rice gives us a mnemonic for all soft tissue injuries. For torn ligaments, pulled or bruised muscles, and muscular lesions, the Rice rule generally offers the best approach. Rice stands for which action to take and in what order. R stands for rest, I stands for ice, C for compression, and E for elevation. R for rest means the injured person should first sit down, keep still, and rest. If there's an open wound, such as a cut above the soft tissue injury, you should bandage this with a sterile dressing fixed in place with some tape. Then comes I for ice. You probably won't have ice with you, but you can make an improvised cool pack by slipping on a disposable glove, digging into some moist soil, then turning the glove inside out and tying a knot in it. Once you've made this ingenious cool pack, give it to the accident victim so they can put it on the knee where it hurts most. Next, we come to C. This stands for compression. For this, you take a standard dressing or gauze bandage and tie the cool pack firmly to the knee joint so that the cool pack applies firm pressure. As well as creating a cooling effect, the pressure helps to prevent further internal bleeding. The last step is E for elevation. As the individual is already sitting down, the best thing is to carefully place a couple of backpacks under the lower leg of the injured knee to raise it up. Ideally, it should be at least the same height as the heart to minimize the amount of blood flowing into the joint.
Generally, this injury will mean the tour is over for the person affected, so you will both have to decide whether you can descend together or call for an organized rescue.